Good afternoon. We'll get started. On today's briefing, we'll hear from Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Weston, Director of Medical Services for the Office of Emergency Management, and Darren Roush, Health Officer and Director for the Greenfield Health Department. Thank you all for joining, and Mayor Tom Barrett, we'll start with you.
Well, thank you very much, Catherine. Good afternoon. It's been a busy week here in Milwaukee, even with the Democratic National Convention scaled back as much as it is. But there are a couple issues that I wanted to touch on that I think are important. The testing continues, and we had our call this morning, and I'm sure that Dr. Weston is going to expand on this. But the most encouraging news that I have heard literally in weeks when it comes to testing is that the positivity rate was less than 5%. And we know that there were times when it was at 10% and it's come down gradually. And if we can maintain that, that is absolutely good news. But again, I'm going to let Dr. Weston talk about that much more in depth. The testing has continued, not at the level we would like, quite honestly. I think I certainly would like to see more people being tested. But right now, we still are working through the UMO site, which has got the most people coming to it. And secondly, the site at Custer High School, where we've got a lot of people being tested there as well. We continue our preparations for the fall elections. As I said earlier, we're working to get lock boxes. I think that people around the country are recognizing that this is going to be an issue. So this is not just a local issue, but we have been pretty much ahead of the curve on this. We had lock boxes at several locations in the spring election. We felt that they worked very, very well in the spring election. And so we are planning on expanding on that. It's my hope that we don't see legal attacks. Again, I'm starting to see some legal attacks directed toward them, which will give you a flavor of the partisan nature of what's going on around voting right now in America. So that's something I'm very, very sensitive to as well. So again, we're continuing to do the work. We're continuing to work on the tracing, getting more people in. We had a number of people helping from different departments when it came to tracing. Some of them have gone back to the library, to other places. So our health department is working to get more individuals trained for that. And we want to make sure that we can have people who can stay for a longer period of time, because we don't want to just go through the training exercise and then lose them to something else. So the work continues. We know that the numbers nationally, we're still seeing a lot of deaths. We're over 170,000 deaths in this nation right now. Looking back 6 months, obviously, if we would have had leadership 7 or 8 months ago, I don't think we'd be where we are today, but we're going to continue to do everything we can to try to deal with this. So with that, I'm going to turn it over to County Executive David Crowley, who's been working very hard on this as well. Mr. County Executive.
Thank you so much, Mayor Barrett, and thank you for your leadership on this. And just to echo the mayor's comments, I'm happy to see the positive downward trend in Milwaukee County, but we have to remain vigilant. So as soon as we start feeling hopeful and we begin to let our guard down and we loosen up our good habits, we can easily see this virus rear its head up back again. So we must remember the 3 W's, which is watch your distance, wash your hands, and wear a mask. The decisions you make now will impact how we're able to manage the virus and determine its effects on the community this fall as we continue to fight the coronavirus and as flu season actually comes around. And with that, I want to make sure that I say thank you to all the local health officials who have been working hard on educating the community on ways to minimize the spread of the virus, and who have been working around the clock to keep up with contact tracing. We've been combating this virus for more than 5 months, and our public health officials have faced a significant portion of this burden. And I know the challenges that many are facing about going back to school and the planning that comes with that. And so we must continue to make decisions rooted in science and the data that's available to us. We're living through unprecedented times, and I applaud the leadership of our local public health officials. And it's great to know that we have public health officials who are going to do everything that they can to keep us safe. And I'd like to switch gears a little bit just to talk about the Milwaukee County budget. And I want to continue to stress on these calls that we are facing a budget crisis at Milwaukee County. The cost to provide the services that our community is increasing every year. And the COVID-19 pandemic has only intensified the need for county services. The situation has taken a huge toll on the county, but it's hit communities of color the hardest. This year, Milwaukee County is starting with a budget gap of about $42.5 million. And we're looking for community input on how to address these shortfalls. And so we believe in participatory budgeting. And we're using a balancing act, which is a digital platform that gives individuals an opportunity to share their suggestions on balancing the county's budget. In addition to submitting the proposed budget, users can approve written feedback on how elected officials can better solve the county budget's constraints as well. Completing the process will take only about 15 minutes, and we would greatly appreciate people's ideas. This tool is about building a more sustainable future. So all revenue options, both currently available and those that require a change in state law, are on the table this year. So please check it out. And I, along with other county supervisors, will be hosting several budget open houses, budget town halls. The first two meetings will be held virtually. The first one will be held next Tuesday, August 25th at 9 a.m. and on Wednesday, September 2nd at noon. For a third open house, we'll be offering a hybrid of virtual and in-person option, and that's going to be on Tuesday, September 8th at 6 p.m. And that's basically due to the technological constraints. But if you want to make sure that your questions are asked and you want to get them submitted, please submit them at least 24 hours in advance to the meeting. And you can visit our website at county.milwaukee.gov for more details around that. And finally, I want to conclude on a positive note that as of last week, the Milwaukee County Zoo moved into phase 2 of its reopening, which no longer requires advanced ticket reservations. Attendance will continue to be monitored, and it's still going to be limited to make sure that we're adhering to the safety and physical distancing guidelines. But we're proud to have Milwaukee County Zoo as a local asset that all people can enjoy, especially with the beautiful weather that we've had recently. So please enjoy and continue to respect our zoo guidelines, and we definitely appreciate everyone who's been supporting Milwaukee County Zoo and enjoying themselves outdoors. And with that, I want to say thank you all again for joining us and hand it over to Dr. West.
All right, thank you, Mr. County Executive. Good afternoon. First to our numbers, we have had 22,862 confirmed cases of COVID-19 in our community and 395 individuals who've died. So as the mayor mentioned and the county executive mentioned, with some good news to report, we're seeing a decrease in our percent positivity in Milwaukee County. So earlier this week, we hit 4% positivity. That's lower than we've seen since the very beginning of the pandemic, way back in March. So I think that the combination of the city of Milwaukee's mask mandate and some municipalities, in addition to the implementation of the statewide mask orders, certainly combined with awareness, messaging, and all the great mitigation and prevention efforts from our local public health officials, is having a promising effect on our disease burden. So this is a time, as the county executive mentioned, to continue to stay vigilant with the distancing and the mask wearing that the members of our community are working so hard to maintain. Shifting a bit, as many of our children head back to some sort of schooling in the coming weeks, we'll certainly enter a new phase, an uncharted phase of the pandemic. We don't know how exactly in-person schooling will affect our trends and our disease burden, but we should be prepared for an increase. As for schools, I'll tell you that over the last few weeks, from grade schools to universities, I've heard from deans, principals, school boards, parents, and teachers, each of them struggling with how best to open back up and provide education as well as socialization for their students. While there are different plans and perspectives, I can say that without exception, everyone that I've met is working to do the very best for their students and their communities that they serve. It's often been asked, is virtual, hybrid, in-person learning, which is the best way to go? And unfortunately, there is no best answer, no one-size-fits-all approach. That said, there are certainly best practices. These best practices include cohorting, or separating out of students and teachers into groups for the duration of the school day to minimize exposure, modifying the built environment to promote physical distancing, certainly universal mask wearing, resourcing underfunded schools to ensure access to virtual-based education options, and clearly defined gating criteria that include both institution-specific metrics as well as broader community metrics. And on that metrics front, we're working to update our public-facing Milwaukee County dashboard in the coming weeks. We'll have a new tab. It'll highlight more age-specific information to understand those trends as well. So moving forward, we must not let the perfect be the enemy of good. So we know that kids won't always maintain physical distancing. We know that masks will fall off, they'll be momentarily forgotten. However, having the expectations and the goals and the policies in place will allow for an additional layer of protection. And again, there's no one-size-fits-all approach. Each district, in conversation with local health officers, with health professionals, will determine what is best for their children and their community. There's no perfect choices here. We as parents will certainly stress over what to choose, and this is normal. You're not alone in your stress and your anxiety and your lack of knowing what the perfect choice is. But if we have our best interests of our children in mind, I think we can be comfortable with our choices moving forward. And we'll certainly all learn and adapt and find a way to persevere through the year to come. In the meantime, we can work to keep our community as safe as possible. So continue your physical distancing, continue your mask wearing, and we'll need to be adaptable moving forward. Thank you and stay safe. And I will hand it to Director Rausch from the Greenfield Health Department.
Thank you very much, Dr. Weston. It's my pleasure to join today and talk through our weekly epidemiology report with the most recent data related to COVID-19. Highlighting on a couple things that Dr. Weston mentioned, I'm happy to share both our community-wide report today as well as data related to our report of school children. So just to orient you to the screen here, on the left-hand side of the screen, I have our graph of new cases of COVID-19 along with the 7-day averages for both the Milwaukee County suburbs as well as Milwaukee City, excuse me. And on the right, I have daily cases in Milwaukee County in school children. So we're specifically looking here, school children between the ages of 5 and 17. And what I want to point out here is that the trends that we see and we have seen are very similar amongst both populations. The numbers of school children impacted by COVID-19 have been less, but certainly there have been an exceptional number of cases amongst school children. So we see a definitive 2 peaks, both for City of Milwaukee adult population as well as in our school children. We see a very pronounced peak amongst school children in the suburban communities that has now kind of started to tail down, which is very positive. And we can see our cumulative numbers here at the top. Just to give you a sense of what's happening in terms of summary statistics for Milwaukee County school children, there have been nearly 20,000 school-age children tested. The percent positivity over the last 3 months among school children has been 10.5%, and that equates to just shy of 2,000 tests. We have 1,924 school-age children who have been positive with COVID since March 1st, with 26 of those hospitalized and fortunately 0 deaths. So certainly there has been disease amongst school children. And we certainly see, as we see here on the screen on the right-hand side here, and I'll make it a little bit bigger, we see that the number of cases of COVID-19 amongst school-age children increases with age. So we tend to see less cases, between 5 and 9, a few more in the middle school age between 10 and 13, and then we see a pretty good increase with each additional year between 14 and 17. And that would certainly be reflective of more mobility, more ability for older kids to have gone out and participated in activities that may have put them at risk. I'll talk about testing trends for the entire county in just a moment, but here we see the trends amongst school-age children. We see a pretty consistent drop-off in testing overall, and we certainly see a corollary to the positive tests here. We see a slight decrease, but largely flat, nothing statistically significant in percent positivity amongst school children. So now I'll shift gears and show you the data for the entirety of Milwaukee County, just to get a sense of what's going on in the data here. Again, across Milwaukee County, we are continuing to see a downward trend in COVID-19 cases, which is very positive. Our rate of 7-day average cases in the suburban communities has now gone down to a level that we haven't seen since early July, so that's pretty positive news. And the same for the city of Milwaukee. We've seen that average go down from a high that we hadn't, or from a previous point that we hadn't been at since June 15th, so middle of June. So we are trending in the right direction, but certainly we want to be very cautious in how we move forward, because that has a certain impact on how much more disease we have going forward. Deaths in Milwaukee County are relatively stable and have been stable for the better part of a month and a half, a little bit more. On average, we're experiencing about a death or two per day, it seems, and that's been pretty consistent, as I said, since mid-June. Our disease rates in terms of doubling times has increased. Currently, our doubling time in Milwaukee County is about 75 days. For the state, that number is about 39 days. We've looked at reproductive number, or the transmission rate, in the past, and this value has largely been below 1 since early August, which is great because we want to have that number below 1 because that indicates suppression of our COVID pandemic. When we look at both the transmission rates across the suburban communities as well as the city of Milwaukee, with the city of Milwaukee on the top and the suburbs on the bottom, we see the trends have largely, since August 1st, been pretty similar. We started out at 1, we dipped down a little bit more with a little bit of an increase over the last few days, but still largely below 1, which means we should be suppressing COVID in our communities. We've tracked demographics, and these trends hold true pretty consistently with what we've seen in past weeks. One particular note has been a recent uptick in the white population. And in terms of raw numbers, the white population in Milwaukee County now has more cases than the African American population. So you can see here in the lower left, the white population is the blue line, and the black or African American population is the reddish line. And we have seen over the last week and a half, the blue line cross the red line. So we have more absolute cases in the white population, but the rates amongst the Hispanic population are still double that of the African American and Asian populations, and are still significantly higher than the white population. Moving on, we'll talk about testing. As I mentioned in the school-age kid report, we have seen a dramatic decrease in overall testing over the last several weeks. 6 weeks, we have seen a significant drop in testing. So week 17, so about a month and a half ago, we had reached our peak in terms of testing in Milwaukee County, and we've been decreasing since then. Fortunately for us, that decrease has also been aligned with the decrease in percent positive, but certainly I want to emphasize that testing is available for those who need it, and we encourage you, if you have symptoms or if you have concerns about being COVID positive, please make sure to get a test. And you can call 211 and find information about where testing sites are located. Our 14-day trend for percent positivity is not statistically significant, fairly flat, inching downward very, very slightly in the county overall. And then lastly, I'll end with our 2 maps looking at COVID-19 disease since the beginning of the pandemic. So when we look from March to August, we see a lot of COVID activity throughout the county. The red areas are certainly the hotter areas in terms of disease incidence or high numbers of cases found in those census blocks. When we look more specifically at the last week, we see here definitely the red areas indicate a lot of COVID activity. So we see a lot of COVID activity this week, a little bit more diffuse across the county. We still see a lot of cases on the south side of Milwaukee. We see a stronger presence of COVID in the northwest side of Milwaukee, but we also see many of the southern and western suburbs having a lot more cases than we have seen in previous weeks. So that's something that we want to pay attention to. I'll just end with a few comments related to COVID-19 disease in the county. Certainly we know there's still COVID-19 in our community, and while we know those rates are going down, we can't take our foot off the gas pedal as far as following the 3 W's. We need to wear a mask, watch our distance, and wash our hands. The current rates of COVID-19 in our community have impacted what a school return looks like. Public health has been and will continue to be very involved with working closely with school districts and private and parochial school leaders to make those informed decisions. Many schools, as you've heard, are choosing to open in a virtual format. We know others are considering opening in a hybrid format, with half of the school cohorted and attending in person on 2 days a week, while the others might be learning virtual and then vice versa later in the week. And still others are choosing to start in person. Most importantly, we need to remember that the success of school reopenings will continue to depend on the choices we make as a society. We can continue to limit the spread of COVID-19 disease transmission and the likely introduction of the virus in our school setting by following the 3 W's, by making personal decisions and personal choices that have a positive impact on disease rates. And in the short of it, we cannot have long-term success unless all of us are in this together. So in conclusion, as stated previously, while our trends are looking promising, we still must remain vigilant. Thank you very much for your time, and I'll turn it over to Catherine.
Thank you, Director Rausch. Knowing the mayor has to hop off at 2:30, we'll start with questions for him. Our first question is from Mark Stevens with CBS 58. And he asks, Mayor Barrett, can you talk about the additional businesses that were warned and the one that was cited 3 times for $1,500?
Yes, I can. A number of businesses, particularly in the Walker's Point area, have been concern to the health department. And there was one in particular that, as the questionnaire mentioned, has received a fine. I want to be clear on this because I've talked about this before. Our goal, and my personal goal, is not to ding anybody. Our goal is to have people comply with the ordinance. And the best way to make sure that you're not going to get penalized if you're a business is to comply with the ordinance. So there is a graded step, if you will. We don't come in right away with the hammer. There are warnings that come prior to that. So it's going to be those businesses that simply disregard what the health department is saying that are going to get fined. And so I don't have the list of businesses in front of me, but again, this is pretty straightforward. If you comply with the law, if you work with us, you're not going to get dinged with this fine. If you ignore the law or if you flaunt the law, that's where you're going to run into challenges. So I view the mask wearing right now as a patriotic gesture, that you're doing this for our country, you're doing this for our state, you're doing this for our community. And I don't think it's a lot to ask. And I think, as Dr. Weston and as Darren Rausch have said, we're starting to see progress going in the direction we want it to go. So let's get through this. Let's get through this. And the more we work together, the quicker we're going to get through it.
Thank you, Mayor Barrett. Our next question is from Allison Durr with the Milwaukee Journal-Sentinel, and perhaps you've got a response here. She's asking, have there been any positive COVID tests of people present at the Wisconsin Center during the DNC? And if so, what steps have been taken in response?
So I saw that question as it was posted, and I texted to my staff, and they've been feverishly looking to see if there have been any positive tests. We haven't gotten any response yet about any positive tests in the last couple of days. So I don't know of any. That doesn't mean there aren't any. We just simply don't know of any right now. If it does happen, there's a protocol that the health department is following. Now, with the convention ending today, obviously it's going to be a moot point after today, at least as it relates to the convention.
All right. Well, thank you for looking into that update. And then I think what I'm seeing is the last question for you, Mayor Barrett, and then I know you'll have to jump, is from Tim Vetcher. And he asks, how many K-12 schools in Milwaukee have had their plans approved and are allowed to reopen?
So we can double check these numbers, but on our briefing call this morning, my recollection is there were maybe 31 plans that have been submitted that cover approximately 45 sites, different sites. And roughly, I think a half a dozen have been approved. And again, these are rough numbers. And it looks like there's 9 or 10 more where they're getting information right now. So they're working through that. I know that there is a lot of frustration. And I think there's frustration everywhere. And the frustration at the health department is that you've got a situation here where the hope was that at some point the federal government would set the guidelines. That did not happen. The hope then was that the state would set the guidelines. That didn't happen to the extent that they needed those guidelines set. So that puts our health department, which is working tirelessly on a whole range of issues, to have this added to its repertoire. and that's been difficult. But again, there's been 31 submissions. I think five or six have been officially approved, and then there's a handful that there needed revisions that are in the queue right now. So they continue to work on them as fast as they can.
Thank you for that update. And actually, the last question I'm seeing in the queue right now is for Darren and Dr. Weston, and it comes from Hillary Mintz with WISN 12. She says, several school districts in Milwaukee County have chosen to start the school year virtually, but will offer in-person day camps for families in need. Does this defeat the purpose of staying at home? Is there still a risk of gathering kids together?
Yeah, so it's a good question. We know nothing is going to be without risk. So school this year is going to be unlike any other school year we've ever seen. And part of that is going to be that balancing act that will go into the decisions made. So I think regardless of whether it's in person or it's hybrid or it's virtual or any sort of combination of those, we have to stick with the basic principles that I discussed. But the specific plans implemented will need to cater to the community, as well as the individual needs and the disease dynamics in those communities. So, in medicine, we often talk about a patient-centered approach. If you do what's best for the patient, it's hard to go wrong. I think the same thing goes here. If you work with your health officials and you're doing what's best for the students and you use basic best practice principles, it's going to be hard to go wrong.
Thank you for that, Dr. Weston. And I would just add from the public health perspective, we know that any gathering has the potential to spread COVID-19. We don't know if somebody is going to be at that gathering with COVID-19 and potentially spreading it. So that gathering could be a family reunion, it could be a backyard barbecue, it could be a day camp, it could be a school setting, or it could be a school-like daycare setting. None of these situations is without risk. And so certainly it's frustrating that we're in a point where parents have to choose between sending their kids to school and making an income to support their family. But unfortunately for too many families in our communities, that is the choice that they have to make. And it's an untenable situation to be in. We have grave concerns about any mass gathering in public health, but certainly smaller gatherings where physical distancing can occur, like maybe a day camp situation where it's smaller and more controlled, maybe less risky than a large school classroom, but we just have no way of knowing for sure. And again, neither situation is without risk.
This might be kind of piggybacking off of those answers, but Marty Ho with TMJ4 is asking, is there any way to know how big of a super spreader a 50,000 person convention might have been if it was held as originally planned?
Well, so no is the answer. It's hard to know. Presumably, when that was originally planned, obviously it was before we knew about COVID. If we did a 50,000 person convention inside of a indoor enclosed space, I think that would be problematic. I think more, closer to the convention, a lot of people worked very hard on getting plans for smaller groups to minimize risk as much as humanly possible. But certainly a 50,000 person convention, which I don't think was ever discussed once COVID started, would have been problematic.
And I think and I agree with Dr. Weston that we will never know, obviously, what kind of problems that would have presented. But what we do know is that there were issues in Tulsa when President Trump appeared there at a rally that was much smaller than anticipated, but still had several thousand people in it. And the tragedy regarding Herman Cain, who was in attendance at that rally. I don't recall specifically whether he contacted it at the rally, but I remember a number, a significant number of Secret Service people who tested positive. So I think that was one of the driving forces probably in this whole conversation, is that in the one attempt that President Trump made to have a lot of people in a gathering that was only several hours long, you did have some issues. This was a 4-day event that went for hours and each evening. So from a public health standpoint, I'm proud that the Democratic Party, and I'm proud that the city of Milwaukee recognized that this was problematic to have an event of this size. As difficult it is for me to say that personally and professionally and for the economy of our city, I certainly understand why the decision was made.
Well, thank you. And Mayor Barrett, just for you, we have a brief briefing today. So thank you all for your time. Perfect timing for you. And have a great day. Enjoy the beautiful weather.
Thanks.
Thank you.